Welcome. My name is Jesse Weiss, and I'm the president of the Member Advisory Committee. And I'm here to welcome you to the annual meeting for the Aliveness Project. We're going to look back at the previous year and look forward to what's to come. So welcome.
The Aliveness Project is a community center by and for people living with HIV. And our mission is to connect people living with HIV to resources to live healthy, self-empowered lives. The Aliveness Project provides an array of programs and services for the HIV community, including food, hot meals, food shelf, supportive services, including case management, medical nutrition therapy, and other services to keep people living with HIV healthy.
When you come to the Aliveness Project, you see the most diverse cross-section of humanity imaginable. HIV doesn't discriminate, and anyone can acquire HIV. However, certain communities and individuals are disproportionately impacted, and typically it's communities that already experience disadvantage in society because it sets up a vulnerability to HIV. And so that's why Aliveness exists, to help people not just to take care of their HIV health, but to take care of the other life issues and barriers that prevent someone from being able to prioritize their health.
I wish we could not isolate or look at people living with HIV as being different just because of a disease. They are humans, they are full life. It's a work that I'm dedicated to, and I work at Aliveness to contribute to make a difference and hopefully just change even one life.
I've been involved with the Aliveness Project for probably 20 plus years. I've been there as a volunteer, and of course I've been a contributor. You're making an investment in the community, the person, and really you're doing an investment for yourself, that you're really helping people, and they need that support. I think that when you make an investment, you make a contribution to an organization, you find out what are they doing now, and where do you see them in the future. And I see them working in the HIV/AIDS community until it's gone. A mentor of mine, Harvey Milk, he said, hope is never silent.
In recent years, they discovered that when folks living with HIV take medication, it's impossible to transmit HIV. And so when we're working with individuals to build stability in life and to get medical care and medication, it not only benefits that individual, but it prevents new cases of HIV. If everyone could access the testing and care that they need, HIV would be phased out and become a thing of the past.
I believe that we can get to an end of AIDS in Minnesota, and I want to do everything that I can to help lead us to that day, as well as everything that I can to support people living with HIV and helping empower them to live the lives that they most desire.
It's fulfilling working alongside people who are passionate, staff and volunteers, people who care about each other. It's those moments that you make somebody smile. It's those moments that you make somebody, you recognize something in a person. It makes the work, light and pleasant.
Almost every day, someone in Minnesota is newly infected with HIV, and it doesn't need to be that way. That we can get to a day of no new HIV infections in Minnesota, and they can join us in that fight by volunteering at Aliveness, by supporting us with a contribution, by telling their friends and family to get an HIV test and to know their status. There are easy things that we can do to continue to stop new infections and ensure that everyone living with HIV lives long and healthy lives.
Hello everyone. My name is Kerry Boyum, and I use he, him pronouns. I'm a member of the Aliveness Project, and I'm happy to have served as Board of Directors President this last year. I'm so thankful for the staff at Aliveness. I'm impressed with their flexibility and resilience this past challenging year, and how they've continued their tireless service to our members and how they've progressed prevention efforts. I have a lot of gratitude for the flexibility our many members have had while we had to change how we can provide meals and services. I'm thankful for our allies in government who support us through policy and programs that enable us to carry out our mission. So much of what we do wouldn't be possible with our many financial donors. Many individuals, businesses, and foundations have been so generous. I'm also grateful for those who have included the Aliveness Project in their estate planning. But our donors aren't only giving their financial resources to support our mission. So many donate their time. COVID has certainly had an impact on how we've been able to work with the many volunteers who support the work at Aliveness, and I thank you all for your flexibility and continued support. Among our team of volunteers at Aliveness, I have particular gratitude for the Board of Directors. They have courageously moved forward with staff leadership to take us in new program directions to better serve our HIV-positive community. They have worked together with our staff leadership to update our strategic plan. They have prioritized and invested in an 18-month program to help the Aliveness Project strengthen our diversity, equity, and inclusion work. This robust program helps us understand where we are as an organization and where we need to work harder and do better. This is especially important because of how HIV disproportionately affects people of color. The U.S. Center for Disease Control and Prevention reports from year 2018 data that Black and African American people accounted for 13% of the U.S. population, but 42% of the new HIV diagnoses here in the United States. We at the Aliveness Project will continue to be a leader to end racial disparities that happen in the HIV sector. So again, thanks to you all for your part in making the Aliveness Project successful.
Hello, my name is Scott Schlafman and I have been gambling manager for Aliveness Gaming for the past 20 years. While gaming has faced and succeeded several challenges over its 26 years of operation, 2020 has been the most challenging. As judged by the general public statement, 2020 was a horrible year, one to forget. We hope to do just that. We were basically closed down for 6 months out of the entire year due to COVID-19 virus. All of our operations occur in one of the most severely affected industries by COVID-19, restaurants and bars. There are several activities that we used to conduct that have not come online due to ongoing social distancing requirements. The tri-wheel and bingo as of this date are still not being conducted. Taken altogether, the closures and restrictions have cut our annual gross revenue by 50%. In 2019, we were roughly a $4 million gross operation. In 2020, we dropped to a $2 million gross operation. This has seriously affected all of our staff. All our employees are placed on layoff with the first closing in March 17th. We have currently recalled only 50% of our staff at this time. We will continue to work with laid-off staff to help bring additional employees back to work. We will be offering training to individuals in other activities that we can currently operate to ensure adequate staffing. With the first March closure, we were required to close down and remove all games. We had to close games even if they were not profitable. This was due to the unknown estimate as to when we could reopen. The November closure allowed us to pause games rather than close them. Because of the accounting and reporting procedures of gaming, sales and taxes that occur for the prior month are reported and paid during the current month of operations. This meant that even when we were closed down, taxes were still required to be paid even though we were closed with no revenue. This placed gaming in a situation of needing to watch cash balances to ensure that we had adequate resources to reopen. Along with the pandemic issues, the rioting resulting from George Floyd's murder did affect 2 of our locations. The saloon and Morrissey's Irish Pub on Lake Street were both looted. There was no damage to any of our equipment, but all the games had been closed from the machines. At this time, all but 4 sites have yet to reopen. There is a regulation as to the time period limit a site can be held under permit without operations. We were unsure as to the possible sale or reopening of Lush. We have remained in contact with the owner, who advises he is still negotiating at this time. If there was a sale, we would need to sign a new lease with the new owner and resubmit to Minneapolis Council for approval, basically starting all over. As such, we have terminated that site at this time. The remaining sites, the 19 Bar, Eagle Bolt, and Burger Dive in Roseville Mall, are currently in the process of reopening this spring. While we were facing all of these hard times, the silver lining per se was that sales were up during the periods when we were open. Gaming follows the economy very closely, with individuals having more available funds in their pockets because of stimulus payments, from saving money, not doing other activities, and other reasons. When they were able to get out, they were playing. Thus, gross sales were continuing to increase during these periods we were open. With the warm weather, vaccines being administered, and we are beginning to see the gross sales again increase since our reopening since January 2021. In regards to donations back to the Aliveness Project for the year 2020, we were able to return $86,000 to our parent organization. Our budget allotment for the year was $96,000. Only $10,000 short for the year. Considering all the challenges, we didn't do too bad. The number of new cases of COVID-19 and hospitalizations are beginning to spike again. We are hoping that with vaccines, along with masks and social distancing, will allow at least our sites to maintain the current level of 75% occupancy. We are hoping that the summer will be peaceful, and we thank you for your support.
Hi, my name is Matt Toburen, he/him, Executive Director of the Aliveness Project. After such a difficult year, I'm proud to announce that the state of aliveness is strong. This past year, we pivoted in order to meet the needs of our members during COVID, kept our doors open by serving to-go meals, and increased our food shelf by distributing twice as much food as the year before. Our case management and dietitian services continued to take on new members, and our HIV prevention team grew, expanding our staff and increasing our HIV testing and outreach into LGBTQ and BIPOC communities. Despite all the challenges and changes that we faced, we are still growing as an organization and look forward to eventually reopening later this year when we can do so safely, and to once again sharing a meal with you in person. We have a number of new programs and initiatives that will benefit members and continue efforts to end the HIV epidemic. These programs include, first, a new mental health program. We now have an on-site therapist who is available to meet with all members free of charge. If this is something you are interested in, please let us know and we can get you connected. Second, housing. We are incredibly proud to be awarded major new grants that will allow us to help house our homeless members. We know what a huge need this is and what an incredible opportunity we have to transform lives. More details will be coming out soon. And third, we are launching a new free PrEP clinic. PrEP is an important tool in the toolbox in helping prevent the spread of HIV, and we are incredibly excited to provide this service to the community. Help us spread the word and send us any friends that are interested in getting started on PrEP. Despite everything we've gone through in this past year, the HIV community continued to support one another and provide hope and light. Let us all take a moment to remember and honor the members we lost this past year. Thank you for all you do to make Aliveness the heart of the HIV community. I look forward to seeing you soon. Thank you.
My name is Jill Reyes. I use he, him pronouns. I am a member of the Aliveness Project, and I also sit on the member advisory committee. And I've recently been employed as a member of the outreach team here at Aliveness. It is my pleasure and honor to present the 2020 Aliveness Legacy Award. In 2020, Aliveness was faced with unprecedented challenges. Our entire meal and food chef program were altered to distribute to-go meals and curbside pickup groceries. Our award this year is given to all the amazing volunteer, staff, and community members who went above and beyond to provide essential food services to keep our community fed and healthy. The Aliveness Legacy Award go to the following individuals: Abraham W., Alex P., Andre K., Arion B., Brad B., Brad E., Brianna M., Chad S., Charlie H., Corey J., Daryl A., David R., David S., Dustin R., Ellen M., Galen S., Georgia M., Innocent O., Jackson R., Jacqueline N., Jimmy M., Joe S., Josephine M., Justin Murray, Ari Anderson, Kenneth K., Kevin M., Chris K., Laureen P., Mary K., Matt H., Mel K., Moses F., Olga S., Peter F., Rick L., Sally Jane E., Sarah O., Stacy M., Terrence H., Tina B., Travis C., Juan G. Thank you again to all our wonderful volunteers and staff. This year would not have been possible without you.